Glaucoma is a complex eye condition that affects millions of people worldwide. It is often called the silent thief of sight because it can slowly steal your vision without you noticing until significant damage has already occurred. At its core, glaucoma is an eye disease that damages the optic nerve, which is the crucial connection between your eye and your brain that allows you to see. Your eye is filled with a clear fluid called aqueous humor, which gives it its shape and nourishes it. This fluid is constantly produced and drained, maintaining a healthy pressure within the eye. In most types of glaucoma, this drainage system doesn't work properly, leading to a buildup of fluid and increased pressure inside the eye. This elevated pressure, known as intraocular pressure, or IOP, can damage the delicate fibers of the optic nerve over time. Think of the optic nerve as a bundle of over 1 million tiny wires, each carrying visual information from your eye to your brain. When these fibers are damaged by high pressure or other factors related to glaucoma, they can't transmit this information effectively. This leads to a gradual loss of vision, typically starting with your peripheral or side vision and potentially progressing to affect your central vision if left untreated. It's estimated that over 3 million Americans have glaucoma, but only about half of them are aware they have it. Worldwide, the numbers are even more staggering, with approximately 80 million people affected. The prevalence increases with age, affecting about 2% of people over 40 and rising to nearly 10% in those over 80. Types of glaucoma. There are several forms of this condition, each with its own characteristics. Number 1. Open-angle glaucoma. This is the most common form, accounting for about 90% of all glaucoma cases. In this type, the angle where the iris meets the cornea is open, but the drainage canals become clogged over time, leading to increased eye pressure. Number 2. Angle closure glaucoma. Also known as closed-angle glaucoma, this occurs when the iris bulges forward, narrowing or blocking the drainage angle between the iris and cornea. This can happen gradually or suddenly. Number 3. Normal tension glaucoma. In this form, optic nerve damage occurs despite normal eye pressure. The exact cause isn't fully understood, but it may be related to poor blood flow to the optic nerve. Number 4. Congenital glaucoma. This rare type occurs in babies when there's incorrect or incomplete development of the eye's drainage canals during the prenatal period. Number 5. Secondary glaucoma. This type results from an injury or other eye condition, such as inflammation, tumor, or advanced cataracts. Number 6. Pigmentary glaucoma. In this type, pigment granules from the iris build up in the drainage channels, blocking fluid outflow. Causes of glaucoma. The causes of glaucoma are not entirely understood. Elevated intraocular pressure is the most significant risk factor, but not everyone with high eye pressure will develop glaucoma. Similarly, glaucoma can develop in individuals with normal eye pressure, which is the type known as normal tension glaucoma. Age is also a significant factor, with the risk increasing as you get older, especially after age 60. Family history also plays a role. If your parents or siblings have glaucoma, you're at higher risk. Race is another factor, with African Americans and Asian Americans being more prone to certain types of glaucoma. Trauma to the eye can also lead to glaucoma. An injury that causes the eye to swell, bleed, or become inflamed can damage the drainage system and lead to increased eye pressure. This type of glaucoma can develop immediately after the injury or many years later. Other than that, certain medical conditions also increase the risk of glaucoma. People with diabetes, high blood pressure, and heart disease are more likely to develop glaucoma. Long-term use of corticosteroid medications, particularly eye drops, can also increase your risk. Symptoms of glaucoma. One of the trickiest aspects of glaucoma is that it often doesn't cause noticeable symptoms in its early stages. This is why it's often called the sneak thief of sight. In open-angle glaucoma, which is the most common type, vision loss occurs so gradually that you might not notice any change until the condition is quite advanced. The loss typically starts with peripheral vision, so you might compensate by unconsciously turning your head to see things on the side. In angle closure glaucoma, especially during an acute attack, symptoms can be more noticeable and severe. These might include sudden eye pain, headache, nausea, vomiting, blurred vision, halos around lights, and redness of the eye. This is a medical emergency and requires immediate treatment to prevent permanent vision loss. Some people with glaucoma might experience difficulty with night vision or adapting to changes in lighting. They might also notice that colors don't seem as vibrant as they once did. In advanced stages, there might be noticeable blind spots in your field of vision or tunnel vision. In congenital glaucoma, infants may exhibit symptoms such as excessive tearing, light sensitivity, and an enlarged or cloudy cornea. Parents may notice that the child frequently rubs their eyes or squints in bright light. Early diagnosis and treatment are crucial to prevent vision loss in these cases. As for normal tension glaucoma, it typically progresses slowly and without noticeable symptoms until significant vision loss occurs. It is often diagnosed during routine eye exams when optic nerve damage is detected, even though eye pressure is within the normal range. Diagnosis of glaucoma. Diagnosing glaucoma involves a series of tests that your eye doctor will perform during a comprehensive eye exam. These tests are painless and non-invasive. The first step is usually measuring your intraocular pressure. This is done through a test called tonometry, where a small puff of air is blown onto your eye, or a small probe gently touches the surface of your eye after it's been numbed with eye drops. Your eye doctor will also examine your optic nerve for signs of damage. This is typically done through a dilated eye exam, where drops are used to widen your pupils, allowing the doctor to get a better view of the back of your eye. They might use special cameras or scanning lasers to create detailed images of your optic nerve to look for characteristic changes that suggest glaucoma. Another crucial test is a visual field test, which checks for areas of vision loss. You'll be asked to look straight ahead and indicate when you see a moving light in your peripheral vision. This helps map out your complete field of vision and can identify any blind spots. In some cases, your doctor might use a test called gonioscopy to get a clear look at the drainage angle of your eye. This involves using a special mirrored contact lens to examine the area where the iris meets the cornea. If glaucoma is suspected or diagnosed, your doctor will likely want to see you for follow-up exams to monitor any changes over time. This might involve repeating some of these tests to track the progression of the condition. Treatment for glaucoma. When it comes to treating glaucoma, the main goal is to lower intraocular pressure to prevent further damage to the optic nerve. It's important to understand that while current treatments can halt or slow the progression of glaucoma, they can't reverse damage that's already occurred. This is why early detection and treatment are so crucial. The most common initial treatment for glaucoma is prescription eye drops. These medications work in different ways to lower eye pressure. Some reduce the production of aqueous humor, while others improve its outflow. Your doctor might prescribe one type of drop or a combination, depending on your specific situation. It's crucial to use these drops exactly as prescribed, even if you don't notice any symptoms, to effectively manage your eye pressure. If eye drops alone aren't sufficient to control your eye pressure, oral medications might be added to your treatment plan. These are typically carbonic anhydrase inhibitors, which reduce fluid production in the eye. For some people, laser treatments can be an effective option. There are different types of laser procedures depending on the form of glaucoma you have. For open-angle glaucoma, a procedure called selective laser trabeculoplasty, or SLT, can be used to improve drainage of eye fluid. During this procedure, a laser is used to open the blocked drainage channels in the trabecular meshwork, allowing fluid to drain more effectively and reducing eye pressure. For angle closure glaucoma, a laser peripheral iridotomy might be performed to create a tiny hole in the iris to improve fluid flow. In cases where medications and laser treatments aren't sufficient, or in more advanced glaucoma, surgery might be necessary. The most common type of glaucoma surgery is called trabeculectomy. In this procedure, the surgeon creates a new drainage channel to allow fluid to flow out of the eye, lowering the pressure. Another option is the implantation of tiny drainage tubes to help remove excess fluid from the eye. Living with glaucoma often involves making some lifestyle adjustments. Regular exercise can help lower eye pressure, but certain activities like yoga positions that involve being upside down should be avoided as they can temporarily increase eye pressure. If you smoke, quitting can also be beneficial, as smoking may increase the risk of glaucoma and its progression. It's worth noting that while these treatments can control glaucoma and prevent further vision loss, they can't restore vision that's already been lost. This shows the importance of early detection and treatment. Now, we want to hear from you. Do you or someone you know have glaucoma? What symptoms did you have at first? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.